Hey there, my name is Will McCain, and this is a YouTube video for my UAH biology class. I'm just going over some of the differences between gram-positive and gram-negative bacteria and kind of realistically the effect that they have on my job. I'm an ER nurse at one of the local hospitals here, and as you can imagine, a lot of the people that we see as patients are suffering from ailments that are ultimately related to some type of bacterial infection. One of the main differentiations between the two is that gram-positive bacteria have the large peptidoglycan layer that you can see on the left side of the screen there, and then the gram-negatives have a smaller layer, but they're covered by an outside outer membrane or cell wall. To determine whether something is gram-positive or gram-negative, you use the Gram method, which is otherwise known as a Gram stain. It was developed by Hans Christian Gram in 1844, and it differentiates between gram-positive and gram-negative bacteria by staining the peptidoglycan layer of the bacteria. And it continues to be the standard method for differentiating gram-positive and gram-negative bacteria in hospitals and labs today. Just a little bit of background morphology on bacteria. They come in a wide variety of shapes, but the most common three that we typically see at my job anyway are the coccus, which are spherical, kind of like little balls, the bacillus, which are rod shaped, and then the spirillum, which are spiral shaped bacteria. And then here's a picture showing those three commons. You see the spherical cocci there, the rod-shaped bacilla, and then the spiral. Gram-positive bacteria have that thick peptidoglycan layer. That layer is what retains the stain when it's stained using the Gram method, and it appears to be a dark violet under a microscope. Most commonly they're seen in the coccus and bacillus form, and mainly those are treated with antibiotics. First line of defense for those is the good old-fashioned penicillin-based antibiotics. However, gram-positive bacteria are responsible for some of the methicillin-resistant antibiotics, or MRSA, in which case those are not effectively treated with penicillin. And here's a picture of some gram-positive cocci. You see they're little, tiny little balls, but they retain that stain in that peptidoglycan layer, so they're a dark, rich purple under the microscope. Most commonly, when people think of a gram-positive bacteria, they're going to relate to the Streptococcus, which is one of the most common ones. It's responsible for strep throat, bacterial pneumonia, bacterial meningitis, as well as necrotizing fasciitis, which is the flesh-eating bacteria. And these four have particular significance where I work. Being in the ER, we do see a lot of strep throat. And then the other three, the bacterial pneumonia, the bacterial meningitis, and the necrotizing fasciitis, are severe bacterial infections that progress very rapidly and ultimately need to be diagnosed and treated very rapidly in order for the patient to have a good prognosis. The other one I was talking about a little bit ago is the Staphylococcus. It's responsible for the MRSA, or the staph, typically resistant to methicillin, where you get the methicillin-resistant Staphylococcus aureus. And then is also responsible for other types of staph that are multi-drug resistant, and those are the superbugs as we know them in the hospital. We have a tough time treating those. A lot of patients that develop multi-drug resistant staphs kind of just run out of antibiotics to be treated with, and it's a severe problem. Now, gram-negative bacteria have the thin layer of the peptidoglycan, and that's shielded by an external cell wall there. They don't retain the stain, so they appear a light pink color under the microscope, and they're commonly seen in the coccus, bacillus, and the spirillum. Defining factor of gram-negative bacteria is they're resistant to penicillin. So they're usually treated with specialty antibiotics. Tetracyclines are particularly effective, as well as the mycin drugs. Mycin's a generic term. It refers to basically anything ending in mycin: erythromycin, tobramycin, streptomycin. Those are all generally effective in treating gram-negative bacteria. Here you see, just like we saw a little bit ago, the gram-positive cocci appear that dark rich purple. These are the gram-negative. They appear that light pink because they're not retaining the stain. Klebsiella and Acinetobacter are two common gram-negative bacteria that we find in the hospital. They're responsible for VAP, which is ventilator-acquired pneumonia, CAUTI, which is catheter-acquired urinary tract infection, and things like thrombophlebitis, which is a common infection related to IV placement, as well as just general venipuncture for lab draws, as well as post-op wound infections. As you can see, being in the ER, just the hospital setting in general, 9 out of 10 patients that we see are going to be subject to some form of invasive procedure, whether it be a urinary catheter, an IV catheter, or in severe cases being put on a ventilator to support respiration. As well as, we do a lot of post-op care for patients who have had surgeries, whether it be a knee replacement or having their appendix removed, just any type of post-op care. Those patients are going to be at a higher risk for developing an opportunistic infection related to one of these bacteria. And just to put that in perspective, if you're already being seen in the hospital, you're already on a ventilator, you've had some form of accident or some type of medical condition that has caused respiratory distress severe enough, or even respiratory failure entirely, that you need a ventilator, and you have an endotracheal tube placed down in your bronchioles, that is a mainline kind of a highway for bacteria to get into your lungs and cause an opportunistic pneumonia. And when you're already have a weak respiratory system from the initial event that caused you to be placed on the ventilator, the last thing you want is an opportunistic pneumonia. It's going to increase your length of stay in the hospital. It's going to increase your time on the ventilator, and ultimately reduce your chances of having a good prognosis. Ventilator-acquired pneumonia is one of the, along with CAUTI, are two of the fastest ways to get systemic sepsis in the hospital setting, and that is widespread infection in the blood all over the body. Overall, whether you have a gram-positive infection that lands you in the hospital or an opportunistic gram-negative bacteria that affects you during your stay in the hospital, early identification and appropriate treatment is essential to a good prognosis. And that's just how these two bacteria relate to the job that I do. Being an ER nurse, we see a lot of patients that are in the hospital for ailments that ultimately lead to being a gram-positive or gram-negative bacterial infection, and it is extremely important to differentiate the two so that you know which type of antibiotic is needed to treat the patient with. And the Gram method, again, is still one of the most common used differentiation methods for bacteria, along with culture and sensitivity, but that's a whole separate video. Thank you very much, and thanks for watching.